do the boards of health meet together at all, or they meet separately in the different towns?
Separately, but they have an island meeting, I think once a month, something like that.
I see. Okay.
Yeah.
I was saying that over the last couple of years with the COVID stuff, they've done a lot of joint activity. You know, they all sort of have the same types of policies.
I believe so.
Yeah.
I know that an incident happened in Oak Bluffs, and the health director had to quit.
Yes, I read about that. She came in and found
Correct.
some bullets on her desk which she interpreted as a veiled threat, and she quit.
Some people. Yeah, there were some really awful things that happened, particularly during the pandemic. There was some incidents out in the western part of the state where individuals and their family members were harassed. State police had to get involved.
Absolutely. Yeah.
It was good to see. I mean, there was excellent support from all of the resources. You know, our resources were brought to bear to support folks that needed it in the face of harassment. So, at least to my knowledge, there may be folks out there that didn't experience that support, but to my knowledge, it was a good example of how it can be.
So Kevin won't be here today.
Oh, he won't. Oh, okay.
Correct.
Okay.
And
Hi, Jackie.
I think Mr.
Hi.
Bassi won't be here as well.
Who won't be?
Who?
Mr. Bassi, is Bachi or Bassi?
Bachi.
Oh, Bachi.
Is that why you're here, Jackie? You filling in?
I am on it. I think both Carlo and I are the liaisons. So he and I usually, divide it up. So good to see you all.
Welcome.
Thanks.
Okay, so why don't we get started then, since we're all here, and I'll call the meeting to order. In terms of tonight's agenda, it's fairly short, I think. We'll, of course, review the minutes. We will do what's called a reorganization, which simply means our annual nominating and appointing the chair and the vice chair, which is required by the bylaws. Then we'll go to the tattoo apprentice program, which hopefully everybody saw the most recent version that they sent this afternoon. We've discussed this in the last 2 meetings, and so hopefully we can finalize it. I guess we won't be having a coalition update, although I really appreciated Kevin's email a week or so ago showing the survey of students, and it's kind of disturbing how significant mental health issues are in our schools. And I'm glad the coalition is working on that. And then Ade will lead the discussion on the monthly report, and we'll have public comment if there is any, and then we will wrap up. So without further ado, in terms of the minutes from June 2nd, they looked pretty good to me, as usual, Jackie. Any revisions, edits, comments? No?
One.
Yes, Paula. Go ahead.
This may be, I may be wrong about this, and it's very minor, but there was under the section on the grant, it talked about perhaps using some of the money for the MERV filters.
Yes.
It was written as MERV 12. I believe they're MERV 13s. Small potatoes, but there you go.
Matter of fact, they have MERV 17 as well.
They have, oh, do they?
Yes, they do. But HEPA is the best, the HEPA filter.
Yeah.
So.
Yeah.
There
So I
should be
just
13?
don't even know if that needs to be changed.
It could have just been a typo in my notes.
Yeah.
Hit the 2 instead of the 3, so it should be MERV 13.
13. Yeah.
That's my understanding, yeah.
Thank you.
never let it be said we don't read the minutes in detail.
Fine tooth comb, yep. I'm an editor's daughter.
So I'll make a motion to approve the minutes as written with that one change for June 2nd. Do I have a second? Paula,
Second,
roll call, Carrie,
Yes,
Paula,
yes.
and Rick, yes. So the minutes are approved. In terms of the next agenda item, the reorganization, all the boards are required by our general bylaws to renew or reappoint the chair and vice chair for the boards in June or July of every year. And so we put that on the agenda for today. So I think that we should probably start with the chair. If there are any nominations, and then we can take a vote. And then we'll go to the vice chair position.
I nominate Rick.
Carrie,
that's it.
okay,
So I second that. That's what I was.
okay. Motion to nominate Rick, Carrie second, roll call, Paula,
Yes, please.
Carrie,
Yes.
and Rick. Yes, thank you for your confidence. This has been a very great learning experience for me in the past 18 months. And will continue to be so. In terms of vice chair, I
Are
nominate
you
Carrie.
loving that job there, Carrie?
Fine.
I'll nominate Carrie. Do I have a second?
Happily,
Okay. Roll call. Paula,
yes.
Carrie.
Yes.
Don't scare us like that.
No, sorry.
Rick, yes. Congratulations, Carrie.
Thank
Can I
you.
nominate myself for
Congratulations,
member at
Rick.
large?
You are, I don't know, there should be some good title for you because you are,
Member at large is fine.
because we're a team.
We are a team.
We're a team.
Once we get to the 5-member board, then you can be a member at large.
Mm.
All right. So Ade, you want to lead us through the apprentice program?
Absolutely. So at the last meeting, we talked about amending the body art regulation to include the apprenticeship program. I sent out a draft to the town council for legal review. We went back and forth a few times, and it looks like we now have a final document. So initially, we had a one-time fee of $250 associated with the 2-year duration of the program. That format violates the requirements of Section 22, which is a fee schedule. And Section 22 requires that licenses be annual and expire on December 31st of each year. So instead of having one $250 fee for 2 years, it was changed to $125 per year. We would eventually have to go back to Section 22 and add the fee to Section 22. Town council pointed out that we didn't have the definition of apprentice in our original draft. That has since been corrected. They also pointed out that we can do without the notarization requirements for the timesheets. That has been corrected. Let's see. Town council also thought it would be prudent to reconsider the complete reset if there is a 30-day break in training. That has been changed to include a board review and consideration whenever there is a break in apprenticeship lasting 30 days or more. We've also limited the number of apprenticeships that a body art practitioner can supervise to 2, and we've added the attestation requirement for the apprentice to read Section 23 in its entirety as a condition for obtaining an apprentice license. I believe this regulation is adequate, and I think that the board should be able to vote on this today and pass it into law.
Paula, yes, thank
One
you.
question. The review of that attestation, that's just once for the 1 year or annually?
Every time it gets they get permitted, they have to do that. So
So
it's
it's
an
a 2-year program.
correct,
the-
but it's
the
an annual
apprenticeship.
permit.
So each year they have to review that.
Correct.
Okay. I just wanted to clarify that. Thank you.
Thank you.
Any other comments, suggestions, edits? Looking good. Okay, so I would make a motion to approve the body art practitioner apprenticeship program as written. Do I have a second? Carrie, second. Roll call, Paula,
Yes.
Carrie.
Yeah.
And Rick, yes. So that's approved. And this will be part of section 23 as well. I think you said it right.
Right.
I think the attestation piece, I've been kind of hounding on that, but what I've seen at the Board of Pharmacy, where I'm also a member at large, the token physician, they do that a lot in terms of remedial actions, whenever there are problems, or even in general, in certain situations, they'll ask the person to read a section, and there are a lot of pharmaceutical regulations to read a section. I think it really, in this case, would give the apprentice, a bigger picture than just what they're doing around their particular tattooing. They'll understand, what all the regulations are for the entire facility, and it'll give them sense. So that's good that we added that. All right, a day again.
Can I just jump in?
Yeah.
So since this is passed, then we now have to tailor an application towards this regulation. So the way I see this happening is, there's no real way to verify if they have read the section or not.
Right.
But there will be some kind of language that they have to click on.
Yep.
So
Right, that's exactly it. We're not gonna send the secret police over to make sure. They
Correct.
just attest to it. And so,
Yeah. All right.
okay, monthly report.
All right, monthly report. In the month of June, the health department conducted 26 routine food inspections, 8 food re-inspections, 2 food complaint inspections, 5 housing complaint inspections, 2 camp inspections, 3 pool inspections, 1 pool re-inspection. We issued 1 new food permit, that was for Paulie's ice cream truck, and we issued 9 temporary food event permits.
Is that for Friends and Family Day?
Well, that's Friends and Family Day is part of it. Let's see.
Oh, I don't need to know each one of them. I was just one, because they were temporary, I assumed it was for that.
Friends and Family is definitely part of it. I have a bunch of items here. Hold on. Okay. We issued 1 for the graduation block party, 1 for the Pride Parade, 1 for
Okay,
the
yeah,
Lions Club tent.
Yep.
Walk for Life concession table, Friends and Family, Reading Softball League, Little League Championship. So.
thank you. And can I ask about the housing complaints?
Housing complaint, 352 Main Street. The complaint was about roaches. We were unable to get into the property. It was an anonymous complaint. We tried to reach the person, the complainant, but we couldn't get access. 44 and 54 Ash Street. We tried to gain access. It was a complaint about water leaking into the apartment. The person did not call us back, so we couldn't gain access. 3 Palmer Hill Ave, it was a trash on the walkway. When we did our inspection, we didn't observe any trash on the walkway. It was a pile from movers, and they were already gone by the time we got there. 87 Washington Street. The house was abandoned. It's a mess. We conducted inspections with multiple departments, and that's still ongoing at the moment. We got a complaint about urine dumped on the street. We conducted the inspection, and we couldn't test for urine, and then
They took care of that.
exactly. And of course, 79 Pearl Street.
That continues.
Well, everything is all set with 79 Pearl.
Yeah, it looks a lot
everything-
better. I ride by it. It looks much better.
Yes, absolutely.
Good.
And there was food complaints as well.
Yes, we had Anthony's Pizza. We had complaints about unsanitary conditions. And for Bagel World, we had complaints about a bolt found in a baked bagel. They sent us pictures
Wow.
and everything. Correct. So, but I
Thank you.
mean, we did a thorough inspection, and we didn't find any violations. We thought maybe the bolt came from one of their pots and pans. We inspected all the pots and pans and all their equipment. There were no missing bolts. So, but we used that opportunity to conduct a comprehensive inspection. So
Yep.
That
Yep.
was great.
Thank you.
Yep. Thank you very much. And thanks, Jen.
Yes, Jen, thank you too. You're muted.
In terms of vacancies, it's been like really, really difficult to fill positions. I'm not sure what's going on, but it's unbelievable. So we reposted the full-time public health nurse vacancy. We got 2 candidates to apply, and we plan on interviewing them next Tuesday. Fingers crossed. Hopefully we won't get any cancellations, as we did with the admin position. With the admin, we had 4 candidates, and 2 candidates canceled at the last minute. So it's been
Wow.
really difficult to hire people. I'm not sure what's going on, but that's what we're experiencing so far. But hopefully the right candidates will come along. So
You feel that our salary offerings are competitive that HR has put together?
I believe so. But there is a salary study going on. So depending on the outcome, we might be able to get increase in salaries. We'll see.
And the advertising, do you know where the positions are being advertised? I mean, you got 4 candidates for one, so that must be a good spot, but is that an issue perhaps?
Well, I really don't know what the issue is.
I'm just curious.
I
Yeah.
have no idea, but we tried LinkedIn, and then we got 2 candidates for the public health nurse position.
Mhm,
And when we tried other sites, we only got 1.
mhm.
So
I know that Mass Public Health Nursing Association has their own website and job board. I know MHOA, I'm sure you know these, the
Correct.
MHOA, MAHB, all those places. People are pretty
Yes,
good at
I think
passing the word. So,
yes, I think we posted on all those websites, and we didn't really get much. So
Yeah.
I'm a little bit disappointed, but
Yeah.
we'll keep going.
I hear sometimes people say that, if they have the flexibility that people like a little bit of time off before they, so it may be that people finished up the fiscal year end and are taking a little gap time before.
Yeah. And the month of
in
July,
position.
yeah, the month of July is the worst month to try to hire people because everybody's on vacation. They're all
Yep.
having fun. Like next year, I would be proposing to maybe not have a Board of Health meeting in July and December. All right. So I have a little bit of good news though.
Good.
I'm pleased to announce that we were able to secure the Public Health Excellence Grant for shared services in conjunction.
Excellent. Yay.
In
Great news.
conjunction with the towns of Andover, North Andover, Reading, North Reading, Wilmington, and Linfield. So we have been awarded an annualized amount of $297,200.
Fantastic.
And
Good
what
work.
are the shared service arrangements going to be, or are you guys in the exploratory phase?
Well, we let's see.
And who's the lead community?
Andover is the lead community.
Okay.
So we plan on hiring a training officer responsible for performing standardization of food inspectors, as well as identifying training needs of the staff, arranging for those trainings and tracking CEUs. We also plan to hire an FDA standards coordinator responsible for assisting communities in enrolling in and managing the FDA standards, applying for grants and coordinating operator training opportunities. Tobacco control compliance, environmental health inspector. Let's see. Yeah, we have a few positions we're going to be filling. And
Great.
$297,000 is a lot of money. So that's great.
And
The
that's
term
over-
of the grant, Ade? Yeah.
Say that again, please.
What's the term of the grant? Is it a 3-year? Is it 1 year with 2 renewals? Is it?
Well,
5?
they will be sending us the exact term, but I
Okay.
believe we applied for 5 years, if I'm not mistaken.
Okay.
But
Yep.
once I get the exact agreement, I will share it with the board.
Yep. That's
Okay.
great. That's great news. We were all here before when we got all excited and then didn't quite pan out. So
Nope.
it's even sweeter for that. So
Yes, indeed.
congratulations to you all for the work.
Yeah, thank you very
Good
much.
job.
Thank you.
And this is a lot more towns than last
Yeah.
year that didn't pass out. Did you say Wilmington was part or not part of this?
Part of it.
Yeah.
Wilmington.
Part of it, okay.
Yes.
It is part of it. Oh, okay. That's funny.
Yeah, right, because that,
Yeah,
were-
and Linfield too.
right.
Yep.
Okay, well.
Hmm.
Good.
Curious.
Good things are happening. so-
Yeah.
That's right. That's right.
All right, moving on to the next. As you all know, we received a public health grant, local public health support grant from the state in the amount of $19,642. It was for the sole purpose of assisting the town of Reading with our efforts to enhance the COVID-19 response. And, we've been able to find something to do with the money, which is great. And I would like to give the board a breakdown of how we expended the funds. So going off of the ideas the board gave us at the last meeting, we were able to purchase 4 HEPA filters, 4 packs of HEPA filter replacement, 10 boxes of thermometers, 1 vaccine refrigeration / freezer combination. 2 vaccine storage coolers, 3 laptops, 3 laptop cases, 4 tablets, 4 tablet cases, 1 smart board, 1 smart board mount, hand washing signage, sanitizer bottles, banners, tablecloths, canopy tents, A-frames, wipes. But the sad thing is, unfortunately, we couldn't spend the entire amount. We are left with a balance of 7 cents, and we are having a hard time. We're having a
Good
hard time
job.
spending it.
Good job.
Very good.
That's good.
And I feel for MHOA when they invoice you for that 7 cents, but they will. That's great. That's a great list.
Yeah.
Yes, and I would like to use this opportunity to thank Jen, Jen and Amanda from Public Services, and all the people involved, in making this happen. You know, without
Thank
them,
you.
we wouldn't have been able to do it.
Thank
Yep.
you.
So,
It's
thank you,
true.
Jen. Thank you, Amanda. And thank you, everybody else. All right, let's see. Next is 34 action. They were granted a variance 2 meetings ago, and we conducted subsequent re-inspections, and pretty much they complied with our initial order and all the violations listed on that order. However, when we returned for subsequent re-inspections, we noticed additional violations. The backyard was unrecognizable. There was overgrown vegetation, weeds, tall grass, unkept shrubs, unwanted plants. They pretty much took over the entire backyard due to the warm weather. Like when we did our initial inspection, it was in the winter and it was cold. So we didn't see all those weeds and all those things. So what we had to do was we gave them compliance for everything listed on the initial order letter, and then we reissued another order to address the new violations. So we plan on doing a re-inspection of the new violations next Tuesday. And we are hopeful that they would have those violations corrected by next Tuesday. I will now defer to the public health nurse, Christine, to provide updates on disease surveillance, reporting, and control. Hi, Christine, are you here?
You're listed in the participants.
The 781 number?
8857, yeah.
I'm sorry, can you hear me now?
Yes.
Sorry
Hi,
about that.
Christine.
Yes. Hello.
Hello.
Good evening. So this is a weekly nurse report, date 7/1 through today 7/7. A maiden report was run this morning at 9 a.m. So the data is subject to change. COVID cases right now active are 36 cases over the past week. To break it down, under the age of 5, there were 6 cases. Ages 5 to 18, there were 10 cases, and 18 plus, there were 20 cases. The majority of these cases are experiencing milder to maybe moderate symptoms, at least reported. And deaths have remained at 53. Out of these 36 cases, there are no hospitalizations. And recovered cases, 5,218. Sorry, I should mention that the total case count is 5,324. At the present time, there are no clusters. That does include any cases at schools or recreation. I did get a chance to speak to Genevieve Fiorentino, and Mary Juliana. So everything looks good there. Excuse me, I believe that there was only one case reported at a recreation camp. I'm sorry, not camp, a recreation school program. Vaccine clinics are continuing throughout the summer. We were going to potentially add a couple more on, but I think we're going to do that more towards August into September, just because of people are on vacation, and I think we may have good or better turnout at that point. And it does include all ages at this point that are eligible to be vaccinated. Influenza vaccine for fall 2022 has been ordered. And the expected delivery date is early September. A schedule has already been made, and dates will be posted early so that residents and senior center, senior housing are informed well in advance. And then a reminder will go out right before any clinic. I am waiting on reimbursement for some of the remaining flu vaccine from last year's season, and should be getting that by the end of July. And I am looking into adding to the homebound vaccine protocol, which will be completed, and I will submit it to a date to review and approve. If would like to add the pneumococcal vaccine and potentially the shingles vaccine. There are also some thoughts on B12, but I'm going to be speaking to some other public health nurses and just to see if they're doing that and what their protocol is. And just some miscellaneous events that continue with the bi-monthly Department of Public Health MAVEN webinars. And recent topics included tuberculosis and tick-borne illnesses. 3B Coalition actually has been a little bit busy. There was an emergency drill on 6:30, and I met earlier today with Felicia Ball. I'm just getting to know some of the people well, and Elizabeth Roberts. She is the HMCC program manager. So receiving some web EOC training, and again, just getting to know who is who and the different communities and people involved, and everybody's been pretty helpful. And that's about it for the nurse report.
Can I ask a question, Christine?
Please.
Have you talked about possibly combining the COVID vaccine with these other vaccine clinics as well?
Yes, yes,
Okay.
and thank you. I should have mentioned that. So, Vaccinate RX, I've gotten to know the pharmacist quite well. She's also the owner, and to hold for her or us to hold just an influenza clinic or any of these other vaccines alone, I think reimbursement isn't that great. However, she did say if someone, comes to a clinic for COVID, she would also add other vaccines. If somebody wanted to be vaccinated that particular day, they could be. She would have it available. And I believe that would be included in the sign up that is posted, that will be posted for the event.
Is there a limit to the number of vaccines that one person
So
can
that
have?
you can receive in one? Yes, there is. Well, I believe you can get the influenza and the COVID vaccine at the same time, or in the there used to be, you would have to wait 2 weeks, so that would be the recommendation. With regards to the other vaccines, I do not know, but I will find out.
Okay, thank you.
Carrie, did you have a question?
Yeah, I did. Hi, Christine. Just
Hello.
refresh my memory. We had talked at one point, I know Region 3 was doing a after action conference for COVID response. And I can't remember. I know I asked if we would be able to see it. I don't know if it's been released yet.
It actually just was, Carrie. Yes, I'm sorry. It just
Oh, don't be
just
sorry.
was Tuesday. Yep.
Okay. You know, call me what you will. I'm very interested to read anybody's after action reports, because you learn so much from other
Yeah,
practices. So
Sure.
if that's something that you all can figure out how to share with us, I would love to see it.
Sure.
And
Okay.
and did they and there was a local one done as well, correct?
Correct. There was.
Okay.
And,
Did I?
and I want to say that has also come out. I think that came out actually a few weeks back. Dan Litz, I believe, is his name. And I did receive it in an attachment, printed it, and put it in our like book in the office. But I don't see why I would not be able to share that information. So I'm happy to forward it.
Great. That would be great. I would love to. I don't know if any of my other colleagues.
Yes, I think that would
oh,
be. a
I
great
would,
idea.
for sure.
Yeah.
For
Yeah,
sure.
Okay.
This is the after action from our own incident command
correct,
that Chief Burns was organizing.
correct.
Yeah,
So there's that, and then there's also the regional one. So the Region 3 HMCC, each HMCC had to conduct their own regional one. So there's two. Well, there's more than two. There's lots everywhere, but
Sure.
anyways.
yeah, I'd love to see that.
Combs.
Yeah, that's great. Thank you, Christine.
Okay.
Yeah, I'm glad to hear you. That was a fun WebEOC drill, wasn't it?
Oh yes, and it really has been. I'm trying to learn a lot in a little period of time, but it's been good.
Yep, good. Very good.
Good. Christine, any other infectious disease monitoring that we should know about?
So at the moment, I did note when I ran a report, there was a sugar toxin suspect, and then once I spoke to the primary care and further lab tests were performed, it was negative for hemorrhagic E. coli. So I believe it's going to be revoked.
Okay.
The case will be revoked. No other. No tick-borne illnesses at the present time, over the past week, and no influenza.
No monkeypox.
No monkeypox.
No, I've been looking at that as well.
And the COVID that we're seeing is still Omicron, right? Is it the B45 or do we not know?
So, when you run a report for the variants, they're not sequencing every case. So sometimes they won't provide that information. Sometimes you will see, B1, B2, it will give the specific. I haven't seen that in quite some time. And I can certainly ask one of the epidemiologists the next time I speak with them if they plan to do so.
Okay, thank you.
Anything else today?
Nothing else.
I had one question. I've heard reference to once or twice, I'm not even sure where, about a hoarding task force in the town. What is that about, and like who's participating and what are the goals?
So it's a task force that we put together. It has representatives from health, police, fire, coalition, pretty much to help deal with the mental health aspect of hoarding.
Hmm.
Yeah, we meet like at least once a month.
Okay.
And once we get cases, we just send it to the holding task force so that we can all be on the same page
I see.
and not have a duplicity of work. So
So it's
it's
more of a clearinghouse for coordinating around specific cases.
correct, specific holding cases. Yes.
And the other thing I noticed, I think it was in the coalition report, that the construction of the new offices in the police department is now scheduled to be completed by September. Is that what you?
Right. Scheduled to be completed by end of September. Prior to that, it was November and then
Right.
October.
Yeah.
But now it looks like they're serious about getting it completed by September. So
Good.
Good.
Great news.
yes,
You'll finally have a home.
I'm gonna miss everybody. I'm gonna miss
Yeah.
all the service employees.
Yep.
Him is great, Don, Amanda, everybody, and we're gonna be isolated, but it's for a good reason.
Hmm.
So
I'll just also put a plug in. This issue came up about a year ago when this plan was, proposed and implemented. Was to rethink about the signage at the police station
Mm.
to include health. It's since it's a broader thing, and I think there was some concerns by residents that we want the health department to be welcoming and open, and generally people are a little bit nervous about going into a police department. So if the signage had a statement that reflected actually what's going on in the building, which is health, the coalition, as well as police, and so it's something you may want to chat with Fidel about. I've talked to him about as well. I don't know how people feel about it, but just put that out there.
sounds good.
Rick,
Yes.
I'm sorry, I just wanted to raise one thing that I learned about today before we go to public comment, but I didn't know if.
No, go ahead.
Okay. So it would have, right. So since Kevin's not here, I was gonna kind of piggyback with him. Through my work, I get to hear a little bit about a variety of things. And one of the things that we're hearing about is DMH, and some work that's being done on behavioral health to try and address the crisis really that's happening all over the state. And there's a kind of a three-pronged approach that is in the process of being rolled out. The first one is the creation of these community behavioral health centers. So it's kind of like community health centers, but it's specific to behavioral health services. The second is the creation of a 24/7 behavioral health hotline, 24/7 behavioral health hotline. There we go. That again would be specific to behavioral health. So there'd be access to trained clinicians, kind of like some of the services that our coalition has arranged for access for, but the state is taking this on in a broader way. And that 24/7 helpline is out in procurement right now. Those community behavioral health centers are supposed to, I guess the award's going to be announced this week. And those centers should be operational the beginning of January. And then there's also a plan for the creation, and they're continuing to develop urgent care services for behavioral health. So again, analogous to urgent care that we know for instead of going to the ED, it would be for behavioral health services. So when I heard all of that, I was really, I thought how timely that I could then share this at our meeting, because I think it's important to know that hopefully there are other resources coming to kind of build that net, and it's not simply our folks from the coalition trying to figure out how to piece things together. And that is all that I know. So they're definitely working a number of different tracks to try and increase availability of services, trying to change some internal things so that assessments can be conducted more quickly and so forth. It was really positive to hear. So
That's great. That was
Yeah.
good. Is the 24/7 hotline, is that for people seeking care, or maybe you don't know because I know they're formulating it, but is that for people seeking care, or was that specifically to address the emergency room backlog to try to facilitate getting people out?
yeah, actually the helpline is, that's a good question. I believe that, so the helpline is, yeah. So the way that they're talking about, one of the things they're doing to address the ED backlog is trying to streamline crisis assessments so that instead of it being outside providers, EDs will be able to conduct assessments themselves. I think that the 24/7 behavioral health line, I believe that that's public, but I could be wrong. I'll find out.
Okay.
Yeah, thanks. Good, that's a great question.
Okay, anything else? I should mention that, at least for the public, because I know the board is aware, that the select board did approve a recommendation that will ultimately go to the state legislature after approval by the town meeting to increase the size of the board from 3 to 5 full members. So hopefully that'll happen sometime in the winter. Well, the town meeting hopefully will approve it, and then sometime in the winter. So that's sort of coming. And the other thing go ahead, Paula.
Well, dovetailing with that, I think we are each going into our 3rd year. So
Yeah, I
if
think
we're-
that's true.
yeah. So
Um,
we don't want to have everybody leave en masse, right?
No. And I don't, I actually, the select board reappointed me and Kevin at their last meeting for, I think it's a 3-year term.
Yep.
So I think the terms are still staggered.
Okay.
And I don't know what the actual logistics would be if this gets approved, let's say in the winter, and whether the board would, the select board would say, well, these are now open positions for full board member and go through an appointment process, probably, is my guess.
Yeah, I think Paula, you and I are the same, and I think we
Just about,
are
yeah.
next year, I think.
Yep.
Which is, 23 next year.
Yeah.
So we got a little time. Yes, Jackie?
Yes.
Sorry, so there's 3 full members and 2 associate members. The full terms are all 3 years, and they're all staggered. So some of you, when you joined your first term, you were kind of filling out a term. So they weren't full 3-year terms. So I think
Oh,
Rick
that's
was
right.
completing like a 2 years of a 3-year term. So everybody's term does expire in a different year. I think Paula, you were last year?
I expired last year.
You were reappointed
Okay.
last year.
I what?
So then Terry's term will be up next year.
Oh.
And then
What
Paula
did you
again.
say about what happened with me last year?
Were you reappointed last year or was Carrie reappointed last year? I don't remember.
I think I was reappointed last year.
I
Okay,
think
so then Carrie's term will be up next year.
that's right, because Paula started slightly before me, and I don't remember
a
which
week or
one of
2.
us had it. Yeah, I don't remember
Yep.
which one of us had it, but one of us was filling out, one of us had like a single year, and then another did a full, but yeah, and yes, what you said, Jackie, thank you.
Thank you.
So it sounds like Carrie next year, Paula the year after, me the year after that, in terms of the full members, unless that changes in some way with a 5 members.
Thank you for that clarification, Jackie.
And then again, the board members are aware because they shared this with us, but the House on Beacon Hill is looking at extending the potential for remote public meetings through December of 2023,
Mhm.
but yes, it hasn't been approved yet. I'm not sure whether it was the Senate or the House and who was going to vote next, but that should be coming soon.
The Senate approved it, so it's now for the House to vote.
Thank you.
All right. Anything else? Any other topics, questions? Okay. Absence of that, I make a motion to adjourn.
Did you do public comment section? No.
Oh, I'm sorry. I'm not is there anybody from the public that would want to make a comment? I only see a TMO and I don't know about that. But that's, oh, you. Okay. Yeah.
The other computer.
Oh, you're on the computer. Okay. So, motion to adjourn.
Second,
And Carrie, roll call, Paula,
Yes.
Carrie,
yes.
Rick, yes. Have a great July, everybody.
Night all. Take
Thank
good
you.
care.
Good night, and thank you.
Yeah.
Bye.
Good night.